Welcome to the Nursing Post podcast, all nursing all the time with Ashley Moore and Rosa Horsley. In this episode, we discuss domestic violence, as this week is Domestic Violence Awareness Week and Month. Our goal is always to inform and start conversation.
10 million men and women are victims of physical violence every year by their intimate partners. This is a staggering number to think about. As a nurse, we're taught to look for signs of physical abuse when we're assessing our patients. Are we doing a good job with that?
I think we could do better.
Sure. There are some statistics to think about. Of course, domestic violence does not have a gender or race or cultural or socioeconomic boundary. So that's kind of first off and foremost. You cannot exclude domestic violence because somebody is affluent, nor because they are poor.
Or any race.
Right.
Yeah.
1 in 3 women and 1 in 4 men are victims of physical assault by their intimate partners. 1 in 5 women and 1 in 7 men have experienced severe physical violence by an intimate partner in their lifetime. 1 in 7 women and 1 in 18 men experience stalking, victimization, and have feared for their lives or the lives of their loved one. There are about 20,000 calls in the United States to domestic violence hotlines daily. Women are 6 times more likely to be killed if there's a gun in the home. 15% of domestic violence is caused from intimate partners, and intimate partner violence is more common in women among ages 18 to 24.
Studies have shown that nurses are often the first point of contact in healthcare who frequently encounter women suffering from domestic violence. However, nurses may not be able to recognize or support women presenting with domestic violence. Nurses are mandated reporters, and we play a role in the identification, the responding, the intervention, and the referral of women and men with current or past histories of domestic violence. There is a need for education to ensure that nurses are providing appropriate and adequate skills to help abused women. Referral channels and information sharing need to be established for providing assistance in this process. And there is a need to raise awareness, to identify, to estimate risk, and to document as well as identify suitable interventions. Abused victims say that a compassionate inquiry from a caring nurse helped them disclose their abuse and find help. And some signs that you may assess are bruising in the chest and abdomen, multiple injuries, minor lacerations, ruptured eardrums, delayed in seeking medical attention, and patterns of repeated injury.
There are patients who do not have physical symptoms, but can also have some other troubles. A stress-related illness like abdominal pain or chronic diarrhea, chronic headaches, asthma, or vague aches and pains can be signs of domestic violence.
Mm-hmm.
Drug and alcohol abuse, that's kind of their coping mechanism. Joint or muscle pain, sleeping or eating disorders. You have to think of some of the things when a person feels that their life is not under their control, what they can control.
Absolutely.
Anxiety or panic attacks and depression. There are, unfortunately, suicidal attempts and psychiatric illnesses from domestic violence. Gynecological problems such as miscarriages, chronic pelvic pain, sexual dysfunction or vaginal discharge. Domestic violence can kind of go beyond just physical.
That's mental and emotional as well.
And it can be sexual as well.
Yes.
They describe their partners as controlling or prone to anger and make comments like, no, I don't want them to get upset. That's kind of a little bit of a red flag.
Mm-hmm.
They're accompanied by their partner who does most of the talking. As a nurse, this drives me crazy.
It does. Because you're actually trying to get information from the patient, but their partner won't be quiet.
Yes. And I will very easily turn my back
and say, this is the patient.
Yeah, and say, I need to talk to the patient. Sorry.
Not sorry.
Yeah. And sometimes the patient will seem uncomfortable or anxious in the presence of their partner. They give an unconvincing explanations for injuries if it's not really feasible. I mean, there's some crazy stuff that happens, but if it doesn't seem right, you need to probably
follow your gut.
Yes. If a person is recently separated or divorced, or is reluctant to follow through on advice.
So domestic violence, most of the time it's between, partners, whether that's male, male, female, female, male, or female. So domestic violence is, partner to partner, whether that's male, male, female, female, male, female,
right?
Whatever your partnership is. I think sometimes those two people involved don't realize the impact that it has on the children in the home.
Right.
Children are also victims of domestic violence. Children witness it. Sometimes they are victims of abuse themselves and are at serious risk for long-term physical and mental health problems. Children who witness violence between their parents or their parents and partner may also be at greater risk of being violent in their future relationships.
They think that's normal in a sense.
Yes, because that's all they've ever known. That's
right.
all they saw growing up. So it's their normal.
Right. And that's what people, I think, have a hard time understanding is, well, who would ever think that that is normal? If it's all you've ever known.
That is your normal.
Yeah.
Yeah. So some short-term, I guess, signs and symptoms, starting with the preschool age, would be bedwetting, thumb sucking, increased crying and whining, developing difficulty falling or staying asleep, showing signs of terror, such as stuttering or hiding, and showing signs of severe separation anxiety. In school-age children, the signs and symptoms are usually feelings of guilt about the abuse. And, children internalize things.
Yes.
So they're trying to figure out, like, am I the reason that my parents are fighting? Or, these two people are fighting? Like, what, did I do something wrong?
Right.
So they often try and do blame themselves for the discord. They suffer a lot of headaches and stomach aches. It hurts children's self-esteem. They may not participate in school activities or get good grades. They have fewer friends than others, and they often get into more trouble. As teenagers, they're fighting with family members or skipping school. Their behaviors are getting risky. They're having unprotected sex, and they may start experimenting with alcohol and drugs. They may have low self-esteem and have trouble making friends. They're more likely to be bullied or bullying others, and more likely to get in trouble with the law. Common in teen boys who are abused in childhood, they tend to have, more trouble with the law. Girls are more likely than boys to be withdrawn and to experience depression. The long-term outcomes are greater risk for repeating the cycle as adults by entering into an abusive relationship or becoming the abuser themselves because they know no other way. This is their norm, like we had mentioned earlier.
They think that that's a way that you handle situations.
Exactly. This is what my dad did, so this is how I have to do it, or this is what my mom did, so this is how I'm supposed to do it.
Right. Kids model their parents' behavior.
A higher risk of health problems when they enter adulthood. So mental health conditions like depression and anxiety, It might also include, diabetes, obesity, heart rate, poor self-esteem, and, other problems. When your environment is out of control, as you had mentioned before, you want some type of control. So
That's normal.
it is normal.
That is not.
But it doesn't always, it's not always expressed.
Yeah, the way people
They
deal with
express it
that
differently.
can manifest.
Some
completely.
people do experience eating disorders, whether it's anorexia, bulimia, binge eating. Some people are self-mutilators.
Right.
So there's just a lot of different forms in which children tend to express themselves in when their home environment is not to par.
Right. And even to the opposite of that, where instead of it being something that people perceive as negative, it may be something like throwing themselves into work, and kids that are getting terribly upset that they didn't get 100, that they got like a 96 on a test, or throwing themselves into
over
their
exercising.
sports.
Exactly.
Yes.
Our ESP is
We're on
point.
today.
Yeah.
And so many people would say to a lot of people who are in domestic violence situations to just leave, or they would say, oh, that would never happen to me. Children don't really have that ability to just leave their situation, and that they're still their parents. Even if it's a bad situation, it's what they've known.
Mm-hmm.
No child wishes, to be part of or involved in a domestic violence situation. And most parents don't want that for their children. But for nurses, our calling is to help people and help recognize it. And one of the things that we need to do is explain to the parents how to get into a good situation.
Mm-hmm.
And if the child is at risk, then it may be a thing where you need to call like Child Protective Services, which is never a good time.
It's being in this type of situation. I don't think people realize the amount of stress that it has on the parent who is being abused, the amount of financial worry, the amount of guilt from being a parent and feeling like maybe you can't provide the protection of your children that you should.
Right.
It's not an easy situation.
No.
It's extremely difficult, and it's something that the child and the parents have to live with and go through.
Right. The best thing that you can do is start trying to formulate a plan. Help people be able to get a plan together. Even if people have a really good support system, it's still very hard to uproot everything that you've kind of worked hard to obtain. A home, a family. So many people, especially in my opinion, women, feel like they're breaking the family up if they leave, even if it's because they're in a dangerous situation.
There's a lot of shame.
Yes.
There's a lot of shame having to deal with it. It's shameful because you think you failed. You think you failed your family. You think you failed your marriage or your relationship. You think you failed your family. You feel like you're an unnecessary weight on your family. So it's very hard.
Not true.
Which is not true. I think your family will probably be the number one supporters of you.
Right.
But women who tend to be in relationships of domestic abuse, they're torn down, mentally, physically, and emotionally made to feel like crap.
Right.
So
which is what the abuser wants.
That's what they want. They want to isolate you. They want you to be alone and feel like you're nothingness.
Right.
So
because then they have security and know that you're not going anywhere.
Yes.
That you're going to still be there no matter what they do. And that's hard. And a lot of, from the people that I've known that have been in bad situations, it usually takes a couple of tries for them to leave and actually stay gone. Because there's no sweet talker like somebody that is an abuser.
Let me tell you, they're the most charismatic, charming
Yes.
manipulators.
Yes. And that is sometimes hard for people to see unless you have been involved in it and you can kind of pick up on that. So it does kind of take a trained eye in a little bit of a way to be
Absolutely.
like, I'm not so sure about you.
Yeah.
So a couple of tips for victims that you can give your patients or that you can give anybody, no matter who's listening to this podcast, to leave their situation is to make a safety plan for you and your child. If you have a child, listening and talking to your child and letting them know that the abuse is not okay and it is not their fault.
Absolutely.
Reaching out to domestic violence support person who can help you, and you can learn what options that you have that are close to you. You need to identify a safe place that you can go to. And this is going to be loaded. And this is from personal experience. Because somebody says they will be there for you does not mean that they will actually be there for you when push comes to shove. So you need to have a real conversation with a family or friend that says, this is a situation. Am I truly going to be okay to come here as a safe place and bring my child if I have one? And you can even create a code word to let them know that you're in danger. Maybe come up with a place that you can go to, different things.
Well, we teach our children this in school,
Yes.
Stranger danger. And we teach them, don't let anybody pick you up after school.
Right.
Unless they know this code word.
Right.
Which is the one that you guys have discussed in your family. If a stranger comes to you and says to you, Mommy told me to come pick you up. I'm Mommy's friend, or da-da-da-da-da. And, they're trying to coerce your child into the car. And then your child goes, okay, what's the password? I tell you what, they're going to know the jig is up. They've been caught if they don't know that password.
Exactly.
And so you want to do the same thing with your friends and family, because even in that situation, like you did with stranger danger, you need to do it for this as well.
That's exactly right. And it'll make a world of difference. Keep an alternate phone by if you can. And this may not always be possible depending upon the type of relationship that you're in, since your partner may be the one like controlling the finances and things. For this reason, just a little caveat, they want to know everything. So you want to try to figure out a way that you can find what you need and can have a way to contact people. And some domestic violence shelters actually offer free phones for this purpose.
Well, let me also throw this in there, and I'm not going to take up a lot of time on this subject. 911 works on every single phone, regardless if you have a current service plan or not.
Yes.
If it's charged
and it turns on,
you can dial 911 from that phone.
Yes.
So keep it in a car, keep it anywhere that is safe, buried in the backyard, whatever you need to do.
Right.
Just know it does not have to have service to dial 911.
Right.
And there are a lot of cell phone companies that will take your older phones and you turn them in. Verizon does this. I'm not getting paid for this plug. You can turn your phone into Verizon. And they will donate it to a domestic violence shelter.
Right. And what that does is it gives somebody an out to be able to call for help if there's a controlling significant other or partner in the home. And this may sound like something silly, but in the technology world that we're in, make sure you know somebody's phone number.
Absolutely.
I'm going to be honest. I don't know your phone number, because if I want to call you, I click Rosa.
Yeah. The only person's phone number I know is my father's.
It's sad,
Cell phones have
But
made us
it's true.
stupid.
You know,
Smartphones have made us stupid, actually.
I have a variety of phone numbers that I do have memorized, but make sure that you have somebody's memorized so that way you can call them for help. And make a list of things that you can just, if you've got to leave quickly, that you can look at this list and go, I've packed these 10 things that I know that I need. Because when you're in the middle of a situation where you're trying to get out quick, you're not thinking straight. So have a pre-populated list of what it is that you need to be able to leave quickly. Hide extra keys so nobody can take your car keys. So that way you do have the ability to leave if you need to. You can ask your doctor for extras of things just to have if you're in the situation. But you're going to have to be completely upfront and honest with your provider about why you're needing these things, because they will ask questions as to why.
But I can guarantee, at least with 95% certainty, that if you speak to your physician and let them know what's going on, people donate glasses, samples of medications are left. People donate hearing aids that are no longer being used. If you ask your physician and you let them know what's going on, I can 95% guarantee to you that they will give you these things that are needed.
Or get you to the place where you can get them for
absolutely.
free. Yeah, absolutely. Contact your local family court, or a domestic violence court if your state has one. And you can get restraining orders. If you need legal help, but you don't have money, there are lawyers who will work for free or on a sliding scale based off your pay. Protect your online security, collect your information, and prepare. So
this is part of your plan.
Yes.
Get a thumb drive.
Yes.
A USB. And start saving your documents to that. Scan and save.
Yes. Try to take that information with you when you leave. Have that as part of your list of what you have. So, and you can also take evidence. If, most of us have cell phones now, if they've punched a hole in the wall, take a picture of it, and then it's automatically timed and dated.
Absolutely.
And if there's notes or threats or anything like that, voicemails, leave them on your phone, save them, whatever you need to do to make sure that you have that for the future. Because, again, going back, they're charismatic and they're wonderful and they're really charming.
Girl.
Yes. So you want to have your stuff together, and keep copies of all your paperwork and electronic, documents on an external thumb drive, like Rosa just said. That's your life on a thumb drive, essentially.
Pretty much. Yeah, that's the smartest decision. People lose and break phones, but that thumb drive, you can pretty much hide anywhere.
Yes.
So the nursing role, or the role of the nurse, evidence shows that effects of domestic violence have a profound impact on women and children's health, and that women regularly seek services from healthcare workers, including nurses, for health concerns related to this abuse. Research suggests women who have been subjected to violence tend not to ask professionals directly for help. In a recent women's safety survey, 79% of women who had experienced physical assault and about 81% who had experienced sexual assault had not sought any professional help. There's a stigma here that we have to help break.
Yes.
There's a range of barriers that are keeping victims from disclosing domestic violence. So nurses should begin with broad questions like, how are things at home? And how's your relationship with your partner? Is there anything else happening at home that could be affecting your health? Questions linked to clinical observations could include, you seem very anxious and nervous. Is everything all right at home? When I see injuries like this, I wonder if someone could have hurt you. Mm-hmm. Is there anything else that we haven't talked about that might be contributing to this condition? And sometimes you just have some patients that you just need to be direct with.
This actually happened to me. My husband has a very just one of those faces that he never looks happy on. And when I was in labor, he went to go get something to eat real quick because it was the middle of the night and he was hungry and, you know, I'm being hooked up to all these machines. So I was like, go get you something. So when, you know, when stuff really starts happening, you know, you're here. And when he left out of there, like the nurse turned and looked at me. She's like, does he hurt you?
Oh.
I'm like, no, that's just
he
his
just
face.
offered me something to eat.
Like, that's just his face. Oh, no, it wasn't for
Oh,
me.
no.
It was for him. But I was like, no,
That's
just
resting bee face.
Well, I was like, what do you call that for men? I don't know. But it's really just I'm like,
resting Mitch face.
I love it.
So yeah, as nurses, sometimes you just have to be direct. You know, you have that one patient that sometimes is just like, let's stop beating around the bush and let's get to
it. Yeah.
So are there ever times when you've been frightened of your partner? Are you concerned about safety or the safety of your children? Does the way your partner treats you ever make you feel unhappy or depressed? I think there may be a link between your illness and the way that your partner treats you. What do you think? So it's very important to keep the lines of communication open because as nurses, we are kind of that first point of contact for the patient before they even see the doctor.
Yes.
And as nurses well know, we spend more time with our patients than doctors do. Imagine that.
That's blasphemy.
So you want to make sure that you're listening, and being listened to can be an empowering experience for the person who's being abused, because you know what? They can't talk about it with their partner.
No.
They can't really talk about it with their children.
Nope.
A lot of them are suffering in silence.
Well, yeah, because they're ashamed.
So we need to be the ones that actually listen. And, you know, we have to believe. We have to believe when somebody is saying they're frightened or somebody is saying, you know, I've been the victim of abuse, validate that. This is probably very frightening for you.
Right. Or just telling them that you believe them.
Absolutely. This, you know, you can say this must be one of the most difficult things you've ever had to talk to us about. And, you know, I'm glad you were able to tell me about this.
Right.
And, you know, emphasizing the unacceptability of violence. You know, nobody deserves it. Nobody deserves to be treated less than. I'm all for equality and nobody deserves less. Speak to the patient alone and ask them, does she feel safe going home after the appointment? Are her kids safe? Does she or he, I'm sorry, guys, I tend to do that. Men, you can ask this to men as well.
Yes.
So I apologize. Does he need an immediate place of safety? Does he need to consider an alternative exit from the building? If immediate safety is not an issue, what about his future safety? Does he have a plan of action if he's at risk? Does she have an emergency telephone number? Police, the women's, refuge, help them make an emergency plan. Where would she go if she had to leave? How would she get there? How would or what would take her there? Who are the people that she could contact for support? And, document these plans for future references. That's nursing 101. So just make sure that you're documenting these plans for future reference. That's also nursing 101, because if you didn't document it, it wasn't done.
Well, and that may help if somebody calls back and you've already developed a plan of care with the patient, or a plan of escape. And they're like, oh, well, we talked about this, but I can't remember these other things.
The details, yeah.
If you had that conversation, but then they're calling back and they're talking to me.
The plan's already there. Imagine.
I'm going to tell you, I'm going to be like, I love you, Rosa. So this is what y'all talked about. And then they're going to feel that everybody's on the same page.
Absolutely.
I mean, can you imagine calling back and getting the same answer twice?
Yeah.
That would be huge. And just remember, as nurses, we can support our patients in many ways. but we can't force them to make any decisions. That's not our job. There are going to be patients who suffer from domestic violence who choose not to go back, or who choose to go back to their abusers for multiple reasons. That's not our place to judge. It is our job to make sure that when they're ready to leave, that they have the resources that they need. Since love isn't supposed to hurt physically, mentally, or emotionally, if it does, it's really not love.
Absolutely.
If you love somebody and you know that they're suffering, or if you are suffering, please don't suffer in silence. Find the help. You can get that through the National Domestic Hotline that is available for you, and a lot of communities have support facilities.
Absolutely. And if you're in doubt and you can't remember some of these phone numbers that we give or we list on our page, 911.
Yes. And the national number that you could call is 1-800-799-7233. Guys, as always, thank you for listening to us in this episode. We do find it to be a very important topic. We will list our references on our website along with our show notes. You can find that at thenursingpostpodcast.com. You can always subscribe to be notified of our next episode, and you can follow us on social media. Thanks again for listening to The Nursing Post.